Welcome back to Tuesdays with Timeless. I'm Dr. Stephanie Christian. Today, I'm talking about undoing sun damage. Sun damage is called photoaging, and it's caused by the UVA rays from the sun or from tanning beds. The UVA rays cause cellular changes, and they cause inflammation. And those two things end up causing 5 major changes in the skin that we don't like. Those 5 changes are a loss of collagen and elastin that lead to textural changes, such as enlarged pores and fine lines. Then, as that collagen loss gets worse, there's a loss of tone. So we see sagging skin and creases that are vertical, usually on the cheeks. All vertical creases on the face are due to sun damage. We see brown spots. Those brown spots are usually about the size of a pencil eraser, and they're usually on the parts of the face that receive the most direct sun, on the nose, on the tops of the cheeks, on the side of the face. Fourth, we see discrete vessels. Now, there are plenty of other things that can cause discrete vessels on the face, but vessels can be caused by sun damage. And fifth, there's a diffuse redness that comes from sun damage. On the neck, it's called poikiloderma, but it can extend up along the side of the face. And that combination called poikiloderma can give the skin a very old look. It's sort of a reddish brown, but mostly red. In some people, it actually looks like sunburn, but it doesn't hurt and it never fades. So I'm going to take these 5 changes and talk about the tools we have, the devices we have that treat them. So let's start with the enlarged pores and the fine lines. Laser Genesis is my go-to treatment. It's an easy treatment. It's a laser treatment that has no downtime. The laser delivers thousands of pulses down into the dermis, and it heats the dermis to trigger fibroblasts to make new collagen, and it makes new elastin as well. And this collagen and elastin causes the pores to be reduced in size, and it smooths out the fine lines. So it improves that texture. Afterwards, the patient has sort of a mild flushing appearance. The procedure is absolutely comfortable, and patients can return to their normal activity. In general, the procedure requires 4 treatments, but then it does require maintenance, just like going to the gym, but instead of having to go to the gym 3 to 5 times a week, you have to go to the gym every month or every 2 months or every 3 months, depending on age and the quality of the skin. Next, for sagging skin and those vertical lines and thinning skin, hands down, the gold standard is fractional CO2. Now, that used to be scary because there was so much downtime, but we have brand new protocols, well, not brand new, but fairly new protocols that have cut down the downtime with fractional CO2 nearly in half. And with so many people still working remotely, this is an ideal time to have a fractional CO2 of the skin. What a fractional CO2 does is laser energy make microscopic little holes in the skin that trigger the body's healing response. It heals from the outside in and the bottom up and makes brand new skin cells that have brand new collagen and elastin. And that causes a thickening and a tightening of the skin, as well as a smoothing of the texture. And those improvements in the skin continue for 6 months after the procedure. This is a procedure that actually turns back the hands of the clock. I would say on average, most people say that their skin looks 8 to 10 years younger, but it doesn't stop the clock. So all of those holistic things that I talk about all the time, how you eat, how you hydrate your body, whether you're wearing a zinc-based sunscreen, what kind of products you use, how you manage stress, how you sleep, those are all the kinds of things, plus genetics, that determine how the clock continues to move forward. But this is a procedure that makes an incredible difference in terms of the tone of the skin, the texture of the skin, and the complexion. Next, brown spots. IPL, hands down, is a across the board considered the treatment of choice for brown spots. My favorite IPL is Limelight. This is a broad-based light treatment that aims the light down into the damaged cells. So we're not just getting rid of pigment, we're actually getting rid of the damaged cells that are producing that pigment. And the body sheds those damaged cells. So the spots seem to get darker at first, and then as the body sheds those cells microscopically, suddenly those spots are gone. And interestingly, when those spots are gone, the texture looks so much better, because having that pigment there is deceptive to the eye, because the eye gets trapped on the mosaicism of all that pigment, and suddenly now the eye can see how nice the texture is. But there's actually a textural improvement that comes from Limelight. It's small, it's not nearly the textural improvement that you get from a CO2, but it is actually a nice procedure in between CO2s. I have a lot of people who have finished their 3 Limelight procedures that are the series, and then get one every year because of how nice that little boost in texture is and the glow that they get from that. We use numbing so that it's a very comfortable procedure. Afterwards, there's a little bit of heat, a little bit of redness, and then there's about a week when those spots get a little bit darker. So this is not a procedure you want to have right before a wedding or a reunion. You want to wait until the spots are gone. Next, for visible vessels. The XLV is my favorite vascular laser. It has wavelengths that are great for face veins and leg veins and numerous other vascular lesions, as well as that diffuse redness that I was talking about before, that poikiloderma. For discrete vessels, the handpiece has a foot pad that's cooled to 5 degrees Celsius. So it cools the skin before, during, and after each pulse of the laser, and it helps protect the skin and also makes the procedure much more comfortable, so you don't have to numb beforehand. For face veins, they disappear almost immediately. However, the skin is a little bit swollen and a little bit red afterwards. So if you have returned to work, I usually recommend doing the treatment on a Friday or a Saturday so that the redness and the swelling is gone by Monday. Now, if we're doing the treatment for rosacea or for poikiloderma, that's something different. That swelling is a different animal than if we're treating discrete vessels. Leg veins are also different. Leg veins are bigger, there's more of a nidus, and the way the laser works is it converts oxyhemoglobin to methemoglobin, which is just the breakdown product. But methemoglobin is darker than oxyhemoglobin, and there's not enough of it on face veins that you'll see it, but on leg veins there is. So leg veins tend to look worse before they look better. So now when it's nice outside and we're still wearing shorts and we're wearing skirts, you don't want to be doing leg veins because they're going to show. But when it gets colder and we're wearing long pants, that's an ideal time to do leg veins because they won't be showing. You will need multiple treatments if we're treating an area where there's a high density of veins, simply because we have to go back and back in order to clear the whole area. Now for that diffuse redness of the poikiloderma, that does take multiple treatments as well in order to truly fade it. Probably can't guarantee that we'll get it all the way down to your natural pigment, but we can make a dramatic difference in lightening it. Most people are thrilled with that, but there's a lot of swelling that goes along with the treatment for poikiloderma, just like there's a lot of swelling that goes along with the treatment for rosacea. So you have to plan for some downtime after that. So as you can see, sun damage is one of the causes of some of the most bothersome challenges that we deal with. So the best thing to do is to avoid further sun damage and wear a zinc-based sunscreen every day of every week of every month of every year from here on forward. But we do have devices to treat the sun damage that's already there, and there's no reason not to do that. And for people who are working remotely, this is really an ideal time if you've been considering doing anything like that. The devices we have make an enormous difference for the texture, the tone, and the pigment of previously sun-damaged skin. So if you have any questions, either comment below or give our office a call and come in for a consultation. I wish you well, stay healthy, and I'll talk to you next week.